You heard about the case. Is a patient with a laterally spread lesion, granular type in the sigmoid colon, very extensive, nearly taking half of the circumference, and it's probably about 9 centimeters. In terms of the PED pattern, is primarily a JNet 2A. I usually mark about half a centimeter from the lesion without the cap if the lesion is not too bulky, because I can visualize it better. And I usually take the time when I mark to make my mental map on the position of the lesion. I'm gonna dissect it, as I say, with the Speedboat UltraSlim device and using a tunneling technique. Here I open the proximal gates and I am trimming the submucosal space. I'm injecting using dynamic lift. I'm starting to open the distal gate. I can inject through the device. I'm coagulating a blood vessel that I can see in the vicinity, and slowly, by applying microtension, I keep dissecting to open the gate. I keep progressing, keeping the device parallel to the muscle bed that is at 6 o'clock. And I coagulate the blood vessels as they are appearing from the muscle bed. Always with a dry fill, and then cut slowly. Flushing is good to visualize the bleed, and then very effectively coagulate. Okay, that's my tunnel starting to come along, but I still have some way to go. Again, you can appreciate all the vascularization is at the roof of the polyp at 12 o'clock from the cap. And by dissecting close to the muscle bed, you avoid the bleeding. You can coagulate. We are reaching the proximal gate of the tunnel. We can see the orifice of the gate. And now slowly coming back from the tunnel all the way to the distal gate. And that's the proximal gate. I'm opening the lateral mucosal side on the right-hand side. And now the left-hand side. A little bridge there. It's important not to leave any mucosal bridge to achieve a successful dissection. As this lesion is very large, I'm going to use traction to help to speed up the dissection. Basically use a dental elastic band with another loop of dental floss, and I am with a clip attaching it to the contralateral wall, and it will give me a canopy effect, which it's gonna help a lot to get into the submucosa. This is the second clip, and now you will appreciate the canopy effect that I was mentioning. So I'm gonna dissect the submucosa on the left-hand side, again slowly. I'm trying to get as close as to the muscle layer as possible, and I inject what I need to through the device. The coagulation is very effective. I inject a bit more on the submucosa space. And very few threads on this side. Now I'll finish the right hand side. Nearly there. Bleeding. Always flush, identify the blood vessel, and apply the microwave. Very effective. And this is the final cut. The muscle bed, nice and clean, and always important to inspect it for any perforations. And Purostat to help with delayed bleeding